We record all of our meetings and all of our trainings, and there's a ton of information in our YouTube channel for service providers in the community. So we encourage you to subscribe to that channel and check for updates there. If you would like to not be in the recording, we just ask that you utilize the chat function to engage and ask questions. We love to see faces, so if you're in a place where you can put your camera on and that feels appropriate, we love to see faces. You have the ability to change your name in the little Zoom box, so please do so. We'd like to know who you are, what pronouns you use, and how you might be connected to the coalition. The Coalition on Homelessness is a member-based organization, and this meeting's intent is to bring people together. So service providers, community, government partners, and allies alike. We convene on the third Thursday of the month in the spirit of building community, exchanging important information and timely information, and offering professional development skills and resources. We have next, on our next slide, and I'm not sure if folks are seeing our agenda slides here. There we go. The What We Do slide goes a little bit more into what we do and who we are, and I encourage you to take a look. I believe it's the next slide after this agenda slide. But yes, that'll be up in a second. I encourage you all to take a look. You may be familiar with that slide if you've attended these meetings before. If you're with the media today, we ask that you quote and pull information from either coalition staff or our official presenters. And if there's someone else you're hoping to connect with, please reach out to contact@homelessinfo.org, and we'll connect you with that agency for follow-up. Okay. So we've got a very full agenda today. Some amazing guests to help inform and get your people connected to needed resources. Just running down the agenda and our guests really quick. First, we'll hear about Medicaid changes to eligibility and options for those impacted. So we're talking about refugees, asylees, and other non-citizen adults. That's going to take effect in October 2026. We've got Vanessa Savaretta from NOLA, and Heather Sherzan and Giovanni Delgado from Washington State Healthcare Authority. We will then hear from Maddie Mooney with the Coalition Ending Gender-Based Violence on the new Trans Resource Referral Guide. And then we'll also hear from Haley Watkins from King County Elections, who's here to inform us with some facts and clarification around continued threats to our voting and answer questions that you may have. We'll then move on to our coalition staff announcements portion with the message from our executive director. After that, we'll be taking action together in our advocacy portion of the agenda with Hallie, our policy manager. And then, of course, as I mentioned at the very start, we have time for community announcements at the end of this meeting. So please stick around. We have some announcements already ready to go. But if you would like to join that party, please send me an email, and we'll work to include you. Okay. So to wrap up that intro, I'm going to be switching gears back to our slides, and I would like to ask somebody to volunteer to read out our mission, vision, and values, because this is the work that we all put into action. If you'd like to volunteer, I'm going to scan the audience now. Go ahead and just raise your hand or use the hand raise function. We have a volunteer. Go ahead and come off mute. I just saw a hand flash, and I'm trying to find you again. Tulika, hi. Thank you so much. Please, welcome.
Thank you. Mission: we mobilize our community to challenge systemic causes of homelessness and advocate for housing justice. Vision: a region that acts on a shared sense of responsibility to ensure that everyone has a home. Values: equity, justice, collective action.
Thank you so much, Shalika. We really appreciate you volunteering for that. This is a long-standing tradition of the coalition to read out our mission, vision, and values because this truly is the work that you all do and put into action. So, on that note, I would love to move us forward and introduce our first guests. So, as I mentioned before, to talk about some of the Medicare changes and limitations to eligibility and options that start in October, we have Heather Sherzan and Giovanni Delgado from Washington State Healthcare Authority. They're going to be chatting for a little bit, and then at the end, we'll hear from Vanessa Salvaretta, the senior attorney from Northwest Health Law Advocates. So again, those who are impacted in October, refugees, asylees, and non-citizen adults. Heather and Giovanni, we're so glad to have you with us today. If you need any help with your slides or any other technical things, please let us know. But otherwise, if you're ready, go ahead and take it away.
Awesome. Thank you so much, Kevin. I'm going to go ahead and share my screen. Hopefully I share the right one. It's always tricky when it's on Zoom. It's like gives you a lot of options you're not used to. So I should be screen sharing the presentation. My name is Heather Curzan. I'm a Medicaid Eligibility Policy Manager with the Healthcare Authority. And I'm here with my coworker. I'm going to let him introduce himself and he'll get us started right into the presentation.
Thank you, Heather. Good morning, everyone. My name is, like they said, my name is Giovanni Delgado. I'm a policy eligibility manager with the Healthcare Authority as well. And I'm here to cover a little bit about the HR 1 impacts to Medicare eligibility that take effect October 1st. Next slide. Okay. So beginning October 1st, federal Medicaid eligibility rules are changing, and it will impact certain Apple Health or Medicaid programs. Section 71109, House Resolution 1, amends the definition of qualified non-citizens to include only lawful permanent residents who have met or are exempt from the 5-year bar, conflict of free association, COFA migrants, and Cuban Haitian entrants. So individuals who will no longer be eligible for Apple Health due to the HR1 changes will lose coverage after September 30th. However, these changes do not affect children age 18 and under, pregnant individuals, individuals currently or who will be active on emergency medical services, AEM, and it does not affect the Apple Health expansion. So for lawful permanent residents or LPRs, they'll be eligible for Apple Health if they have met the 5-year bar or are exempt from meeting it. The 5-year bar is a federal regulation that requires many qualified immigrants to wait 5 years before becoming eligible for federal Apple Health coverage, unless their initial status exempts them from that 5-year bar. And I'll go over that in a little bit. An exception to the 5-year bar for those who have not met it is for armed service members who are on active duty or have been honorably discharged. Veterans and family members who are lawful permanent residents will continue to be exempt from the 5-year bar, even if they have not met it yet. Next slide. So if an individual had one of the following immigration status, but is now a lawful permanent resident, they are exempt from the 5-year bar and will still qualify for Apple Health. And this applies to Amerasians, Cuban Haitians, victims of trafficking and their family members, refugees, asylees, immigrants from Iraq or Afghanistan granted the following: special immigrant status and special immigrant conditional permanent resident. And essentially, the list that you see here is basically the group that is being affected by this change, as most of them fall under the refugee category. Currently, somebody that falls into one of these categories is exempt from the 5-year bar, so they don't need to become permanent residents to receive Apple Health benefits. But with this changes, what it's doing is it's now they have to become permanent residents to be eligible for Apple Health. And if they have one of these categories, these immigration categories, then they'll be exempt from the 5-year bar and will continue to be eligible. So in essence, this is the list of individuals being impacted as well. This is a list of the programs that are not being impacted by the changes of HR 1, and that is the Apple Health for pregnant individuals after pregnancy coverage, the Apple Health for kids, the Emergency Medical AEM program, the Apple Health expansion, the family planning only, the state-only funded program, the medical care services, the refugee medical assistance program, foster care and adoption support, and the long-term services and support for non-citizens. So these programs continue to be available as they're not being impacted by the changes. For refugee medical assistance, newly arriving refugees or newly approved asylees or other categories newly approved for refugee benefits may be eligible for refugee medical assistance for a period of 4 months from the date of entry or approved status if they meet the other eligibility criteria. And as I mentioned, refugees will continue to be eligible for children's medical and pregnancy-related coverage if they meet all other eligibility criteria. Something that we just got informed of that's going to change this in positively is that we just got notified that refugee medical assistance is being extended from a period of 4 months to 8 months. But that change doesn't take effect until January 1st. So we're in the process of reviewing this new change and seeing how it's going to impact, what kind of changes we'll have to make to the system and things like that. But that is definitely a positive news that we got, changing it from 4 months to 8 months. Next slide. Okay, so this is the transitional approach that HCA and the SHS is taking to notify the impacted population about what's happening. So in July, this current month, HCA and the SHS, we're going to be verifying the immigration status and eligibility of those impacted individuals. And those whose immigration status we cannot verify, they'll be receiving a letter asking them to update their eligibility information. Those letters actually just went out last week. So that is already happening. The individuals will receive a 90-day reasonable opportunity period to provide information that needs to be updated if they've changed immigration status or have any other changes that may make them eligible for any of the other programs. So the letter is going to explain the HR1 impacts, other coverage options, and we'll ask them to update their information with either HCA or the SHS if they are currently pregnant, had a pregnancy end date in the last 12 months, or they need AEM coverage or MCS coverage, as well as asking them to update their immigration status if it has changed since the last time they applied or reported a change with us at the SHS. As I mentioned before, these are the options for individuals that are going to be losing coverage. We will continue to have, as I mentioned, the Apple Health for Pregnant Individuals program, the After Pregnancy program, the AEM program, the Apple Health expansion, family planning only, medical care services, and they'll continue to be eligible for qualified and dental plans with savings through Washington Health Plan Finder. A little bit on the Apple Health expansion is that it is limited enrollment program, and at this time, the enrollment limit has been met. But it will be my understanding is that it will be reopening again soon, I believe in January. Okay. And now I'll pass it on to Heather so she can talk about the resources.
Thank you so much, Giovanni. So as you all know, this presentation was primarily focused on the citizenship changes that are coming October 1st. It sounds like we'll be setting up some time with Kevin and them to come back to you all to talk about work requirements. But in the meantime, I wanted to give you these resources that we've been developing, right? We've had a couple of stakeholder webinars in February and June, and you'll be able to view those online. And we have some upcoming webinars September and December. There's a lot of information in those webinars, but information that we have as we've learned it. So just wanted to give you these resources ahead of time so you have the time to look at them, review the information, and then when we come back to talk about work requirement changes, I think you'll have a lot of that background information already. So just wanted to share that resource. And I believe these slides will be shared with you and those links will be included. And just a couple of other additional HR1 websites that we have, client-specific changes coming to Apple Health. For our community partners, we have a webpage supporting clients with changes to Apple Health. For stakeholders, we have an HR1 Impacts, and we also have an HR1 Communications Toolkit. So a lot of resources that we're creating and a lot more that's in development. So check back frequently for more information and more documents. So now it's time for questions. I think I saw a couple come through the chat. Giovanni, we have a question. What about for those who are still in the beginning of their asylum's application process?
So somebody that's on pending status with their applications, like I mentioned, they would not be eligible unless they are a child or they're pregnant or have been pregnant within the last 12 months. They'll be eligible for the after pregnancy coverage. The other option, like I mentioned, would be AEM or Apple Health expansion once it opens up for more slots.
Thank you. That may have been the only one that I saw come through. Kevin, did y'all have something? Y'all have other questions on your end that I'm not seeing?
Not that I'm seeing in the chat, but also I may have missed something in the last minute or so, but we can always come back to it, Hallie, unless you have a question that needs to be asked right now. We want to make sure.
Sorry, Kevin. If we could have you guys drop some of those links that you mentioned in the chat, that would be really helpful.
Absolutely.
The web resources. And Allison, I saw that you wanted to highlight a question in the chat as well. Go ahead.
Actually, it's not a question that I'm seeing in the chat, but it is a question that I do want to ask. Thanks to our colleagues from the Healthcare Authority for joining us. I want to just acknowledge that you all in the Healthcare Authority for our state are tasked with implementing the changes that the federal government is imposing. And that is often highly technical, very bureaucratic, complex. We appreciate your coming and giving us I can't say high points, maybe low points is more accurate. But I also want to acknowledge there are many folks on this call here who are actively engaged in helping people who will be affected, if they haven't already been affected, by these massive cuts to healthcare for people in our community. What is the best way for a person who is not deeply involved in the details of guidelines, who might not have the time to come to the webinars that you are hosting, to get information? Is there a phone number that people can call? Is there an email? What are some of the ways that people don't, who do this in addition to helping people try to find housing, food, and other basics,
Mhm.
can access the information they need? And also, I should note, information that is evolving. So you're sharing the information about this upcoming set of changes, but we know there are more coming.
Yeah, it's a really good question. So I'm hoping I can address your question in full. So as far as time, we're doing our best to try to get information out as quickly as possible. You're right, there's a lot of nuanced detail that we need to work through. It is very bureaucratic, and yeah, no one wants to really read these rules and and implement them, but here we are. Um, we try to have all these different trainings and webinars and informational materials because we understand there are limitations. Some people prefer to read their material. Some people prefer to have it presented to them, or, a combination of both. So that's why we have the volume of materials that we have. We also have a, Gov delivery notification, and I can send Kevin and the team information on how to sign up for Gov delivery. And in that Gov delivery, you can set specific notifications for like Medicaid eligibility, so that when we put out information, you'll get that email to know that there's at least information out there that might pertain to your work, and that you should look at. So we also we have something called, I think we changed the name. They used to be called volunteer assisters. I think we're called community connectors now. But these are individuals who are associated with an organization, much like the ones you are all with. And this actually gives them access. You go through a training, you learn about Health Plan Finder, there's a background check. But what it is it gives you access to the Health Plan Finder application system, so that when your clients come in and they want help to either apply for Medicaid, or they need to make a change or report changes, you all would have access to that application system to help clients with that information. That includes if they get letters, you'd be able to go in and view their letters and answer questions for them. So it's just really another avenue for you to be able to connect with your clients, and another way for you to assist them further. Um,
Mhm.
yeah,
Thank you.
I'm
Thank you.
sure. Yeah, yeah. Okay, good, good.
Yeah,
And
that
then
sounds
yeah,
like an
just
important program for us to be able to let folks know about if they don't already.
I agree.
Yeah,
I agree. We try to promote it where we can.
yeah. Thank you very much. We
Mhm.
appreciate you both coming, and I know part of the answer to my question is that we just have to keep inviting you to come
Yeah,
and share this
it's
information, and also, of course, turn to our wonderful colleagues at advocacy organizations like NOLA who are coming up.
yes, yeah. Yeah,
Thank you.
we're part of a whole bunch of different organizations, and WISHA, NOLA, First Friday Forum, King County. Like I feel like we presented almost every organization that we're aware of anyways. So if there's one that you haven't seen us attend and you think could be beneficial, please reach out to us and let us know, and happy to present. I do want to be mindful of time, but I do see another hand, so I'm going to leave it to Kevin on whether we're going to continue or if we want to take questions back.
We are deep into this conversation. Jody, is that you? I think if you can, if it's a quick question, please go ahead and come off mute and ask. But we do have to be mindful of time, so we'll find some ways to get caught up here.
I suspect it's not, so I'll drop it in the chat and maybe you all could get back to me. Thank you.
Thank you so much, Jody. And also thank you, Heather and Giovanni. Vanessa, if you are still with us, please, we would love to hear from you. And we're running a little bit behind, but we know you've only got 5 minutes or so. Hopefully we can have a little bit of time to ask a couple questions. But Vanessa, if you are on, welcome to the meeting, and we're excited to hear from you.
Sure, thank you. Good morning, everyone. I'm just going to try and provide a very quick overview of what these changes that Heather and Giovanni spoke about actually mean for people in Washington, for the recipients of these services. So, for the lawfully present immigrants who are losing Medicaid in October of this year, the numbers that we have most recently are estimated to be about 15,000 people, and that includes 1,700 people who are losing access to long-term services and supports. So those are, NOLA is very concerned about those people in particular because they're highly vulnerable people. The question about what to do for those people and all of the other immigrants who are losing access to Medicaid because of federal decision making, if these problems are to be solved at the state level, we require revenue. And so that's something that NOLA has been looking into and exploring options for generating revenue. For your clients, though, the short-term coverage and care solution for people losing Medicaid are some of the other programs available. And I just put in the chat NOLA's fact sheet, which is available in a few different languages, that provides some of the healthcare options for uninsured immigrants who need to find some source of care. So please take a look at that. Feel free to distribute it if it's helpful to you. This is a great time either for people losing access to Medicaid because of immigration status or because of the work requirements, which I'll touch on shortly. It's a great time to get stories from those people for advocacy purposes. If you have clients who have especially moving stories as these cuts develop, please feel free to reach out to NOLA, for instance, to connect us with the storytellers. Just a really important component of advocacy. And I will put my email address in the chat if anyone wants to reach out to me. Sorry, I'm trying to go quickly here. Moving on to work reporting requirements. Work reporting requirements will apply to people in the Apple Health for Adults program, also known as the Medicaid expansion population, which is not to be confused with Apple Health expansion for immigrants. We're talking about people who qualified for Medicaid because of the ACA. And then the state of Washington deciding to adopt this expansion coverage for basically the short hand for this group is adults who do not have disabilities and do not have children who are eligible for Medicaid because of their incomes. This population, in addition to immigrants, is the population most affected by the changes from HR 1. And one of the requirements that's going to apply to them is work reporting requirements. And there's so much detail to all of this. It's important to know that an interim final rule was published by the feds in June that kind of threw a curveball to state planning processes because of things like the statutory exemption from work requirements for people who are considered medically frail. The rule placed another requirement onto that medical frailty category, that not only do you have to have a condition that is one of the 5 conditions that's specified by the statute, but the condition that you have must significantly impair your ability to comply with the community engagement requirement, which means that people are going to have to demonstrate that their condition, which could be blindness or disability, substance use disorder, disabling mental disorder, a physical, intellectual, or developmental disability that significantly impairs their ability to perform an activity of daily living, and a serious or complex medical condition. In addition to having one of those, you have to show that it interferes with your ability to meet the community engagement requirements. And perhaps Heather or Giovanni can correct me if I'm wrong about this. To my understanding, the state has not yet figured out how to implement that. Because the rule came down so late, it's a new requirement that we're hoping will be implemented as accessibly to people as possible, meaning that there's less discretion to eligibility and enrollment workers, more discretion goes to the providers to say this person is going to have problems complying with the community engagement requirement. Let's see, what else do I want to cover? If you have clients who are going to be losing Medicaid, either because they're immigrants and they're going to lose Medicaid on October 1st of 2026, or because they are unable to comply with work requirements, there are steps that they can take now to kind of try and build a buffer. For non-citizens losing Medicaid, they can explore their options to adjust their citizenship status with an immigration attorney. They can check into whether they or family members qualify for some of the Apple Health specialty programs like Apple Health for Kids or Apple Health for Pregnancy. They should see their care providers as soon as possible before October 1st to get needed care, to get prescriptions filled for the maximum amount possible. They can consider establishing care with a provider at a community clinic or health center, which provide free or sliding fee scale care, and immigration status is not checked at those. Excuse me. For those receiving Apple Health for adults, they should make sure that their contact information is up to date with HCA to ensure that they get all the notices and reminders and to-dos that they need to do. Might start to make a plan for documenting records of work, of attending school, of volunteering, other qualifying activities. Again, see providers promptly and get prescriptions filled. And if your clients think they may be exempt due to medical frailty or one of the other exemption categories, start gathering documents that could help prove they're exempt. This is tricky because as yet, we don't know what that's going to look like. And HCA is working hard on that, and I know is trying to keep the programs as accessible as possible. So I think some of these details are still TBD, unfortunately, but hopefully those are some useful steps. That's what I have.
Vanessa, thank you so much. This is really very good information. I know it's a lot of information for folks in the audience. If people have any questions, go ahead and ask your questions into the chat, as you have already been doing a great job of. Let's see here. I did notice there was a Jody, who had hopped on at the end of the last presentation, had a question about eligibility or documentation and evidence required to prove exemptions, and Heather did put an answer in the chat, which is quite intriguing about self-attestation being okay for a time. So we can try to gather more information on that and then make sure that I communicate that clearly. But yes, I want to just make sure that we do have enough time to answer some of those questions. I don't see any questions coming in, so we will circle back, especially if we do have good, if we have questions in the chat. But I want to keep us moving forward just to stay on schedule with our very full agenda today. So thank you again to Heather and Giovanni, and of course Vanessa. Very, very much appreciate you coming and sharing good information with us. Our next presenter is Maddie Mooney, who worked with the Coalition Ending Gender-Based Violence to develop and create the new Trans Resource Referral Guide. More than an overview of resources, it's really got some great features. And the latest iteration for both physical and online versions Maddie, thank you so much for being here with us. If you are ready, go ahead and please let us know if you need anything. I believe we'll be running slides for you. I see the slides are being uploaded now.
Maddie, if you're speaking, you're muted.
Definitely was speaking and definitely didn't notice that I was muted, so thank you.
Welcome,
Um,
Maddie.
Thank you so much. Again, my name is Maddie Mooney. I'm currently contracting with Coalition Ending Gender-Based Violence to create the 2026 King County Trans Resource and Referral Guide. We'll go to the next slide. So a little bit about me. I've already shared my name. My pronouns are they, them. I'm a community leader, trans healthcare access policy advocate, and longtime organizer dedicated to advancing the well-being of Black and Brown and trans communities. Um, I'm a co-founder of the award-winning Trans Women of Color Solidarity Network and Taking Black Pride. I've led various projects and other work that has helped to expand access to affirming healthcare, behavioral health, and mutual aid for trans communities across Washington State. I was a part of the work group that created the Gender Affirming Treatment Act as well. And my work is rooted in liberation, community care, and building spaces where trans people can not only survive, but also thrive. Next slide, please. So a little bit about this project. Next slide. The resource and referral guide was initially created to connect trans, non-binary, and gender diverse and two-spirit people in King County with specifically affirming healthcare, behavioral health, social services, crisis support, and community resources. The initial version of the guide was developed in 2014, and you can read a little bit more about that here. And then a few years later, the 2017 guide came around and was created by an all trans volunteer work group. And they released a website, which was really amazing, a downloadable PDF, and printed booklet in Spanish and English. Next slide, please. So there are some new factors in the 2026 guide. Um, we created an advisory board, again, full of trans and gender diverse folks who represent diverse lived experiences across King County. And we thought that that was important because even though we all sit under the trans umbrella, we do not have the same experiences. And it didn't seem right to focus on even trans folks who specifically work at orgs. I think that there's also a different level of privilege that you know, those that work at orgs have. And so we really wanted to root this iteration in community members who are not just kind of doing the work under the umbrella of an org, but also doing the work within communities outside the context of an org. And this iteration of the guide is a full reimagining. We wanted to reflect the realities of today's political and social climate. And so we decided specifically to center community safety and data protection. And I'll talk a little bit about that later. Provider consent and visibility safeguards, digital security and infrastructure, accessible print and web-based resource access, community nominated and vetted resources, expanded inclusion of BIPOC trans artists and community storytelling, as well as a stronger focus on rural access and evolving community needs. And so one of the things that we really wanted to root this version of the guide in is safety and data protection. And so when we were talking to our web designers, it just so happened that One of our web designers is a trans woman who specializes in web security, and who is just an amazing, amazing resource. We are hosting our website out of Switzerland, and that ensures that any information contained on this website about providers, about community members can't be subpoenaed by the government. With that, we decided to create a members only section. So a section that really protects providers and social service providers who choose to kind of um, uh, stay behind a wall in terms of protecting the services that they provide. We have seen over the past year and a half, 2 years, that providers, specifically medical providers, excuse me, have been doxxed, have been subpoenaed, have been threatened, and we really wanted to ensure that we were being really cognizant of the safety of not just our community members, but the people who are providing services to our community members. Um, and so, yeah, that is one of kind of the biggest changes about this year's guide. Some of the other core shifts is in the previous versions, the questions was access, and in the 2026 version, the question is access plus safety. And so we recognize that safety without access is not true access, right? Because there will always be people who are not receiving the services that they need because they are afraid of the potential repercussions by folks who are trans hostile. Next slide. So why safety now? And I talked a little bit about this earlier, but right now safety matters more than ever. The ACLU tracked 575 plus anti-LGBTQ bills introduced in 2025. Many of those directly targeted trans and gender diverse folks. 48% of surveyed trans adults have already relocated or considered moving to more trans affirming places in the US, including Seattle. Anti trans hostility contributes to care disruption, instability, and increased vulnerability for our community. And the government is hard at work to try to establish a framework for labeling our community as domestic terrorists, and holding us accountable for a non-existent risk in order to eliminate us through death and assault. We really again felt that focusing on the safety of our community was paramount. Next slide. And so we're really excited also to highlight some new sections. We are focusing on harm reduction, resources for sex workers, immigration resources, community and joy, also support for currently and formerly incarcerated folks, as well as gig workers and performer resources. Next slide. And so here are a few ways that folks can connect. You can email me at maddie@ngv.org. And we also have a request form for copies of the guide, and I can provide those at the end of the meeting as well. Another thing that I wanted to touch on before the end of this presentation is just that we have a social service provider form specifically. We want to keep aligned with our standard of safety and accessibility. And so this means that we need your help in identifying safety and accessibility info that's relevant to our community, but also relevant to your organization. And so I'll post that as well at the end of the meeting. And this also will help us identify potentially social service providers that we don't already have in the guide, or maybe if we do, help us provide more information to community who might be wanting to access services from you. Yeah, so thank you. I think that's the end of my presentation. If anyone has any questions, I would love to answer any of them.
Thank you so much, Maddie. Lot of great information, but also so excited to see this newest version of the Trans Resource Guide. Yes, if folks have any questions, please go ahead and put them into the chat. And Maddie, if you have a little bit of time to stick around,
Yeah, absolutely.
can work the chat and answer some of those questions in there. And then at the end, I'd love to come around and kind of highlight some of those questions and answers. But thank you so much for being here. And also just a reminder for folks, I know we're moving pretty quickly, but we're going to have a recap at the end of this meeting. We'll be sharing slides and links and information to get you all connected to the resources and information that we're talking about here. So thank you again. Moving us forward with our agenda, I am very happy to introduce Haley Watkins, the communications manager from King County Elections. Haley is here to inform and help prepare us to have conversations with our communities with facts and clarification around continued threats to our voting and growing concern from marginalized community members. Many of these efforts have been thwarted, but also were intended to have a chilling effect on voter turnout. And we really couldn't be happier to combat that with facts about voting safety and security. So Haley, welcome. Please take it away and let us know if you have any technical issues or needs.
Great. Can you all see my slides okay?
Yeah.
Okay, awesome. I'm going to start us off this morning with kind of the lay of the land and where we are at with all of the kind of national conversation around elections. I'm sure you've all seen lots of the headlines over the last several months, 12 months, couple of years. And know that there are lots of proposals and lots of conversation and lots of ideas floating around about elections. We do have some good news out of the federal front, which is not something I always get to say. But as you probably know, back at the end of June, the Supreme Court ruled on a long-awaited decision in a Watson versus the Republican National Committee case. That case came out of the state of Mississippi and challenged our ability and other states' abilities to accept and count ballots received after Election Day, even if they met our state's postmarking rules. The Supreme Court did uphold our ability to maintain our postmark rule, which means voters just have to have that ballot postmarked by Election Day and received ahead of certification, which is 2 or 3 weeks after Election Day. So Washington's law stands. There's no changes on that front. That said, USPS has proposed a number of rules over the last year, and there's really 2 that stand out. So last fall, they formalized how they define a postmark, and they said that they do not guarantee a postmark on the same day that something is put in the mail. We have seen over the last several years that in practice that's true anyways, that really you should give it a few days to make sure you get that postmark on time. But the Postal Service has formalized that, and we've particularly seen in more rural communities, the farther you are away from a central USPS processing plant, the longer it's going to take to get a postmark. So we are fairly fortunate in the Seattle area that we do have a large plant, but once you start getting out into further flung parts of the county and especially other parts of the state, you're talking waiting 2, maybe even 3 days for a postmark in some cases. USPS recommends sticking your ballot in the mail if you're returning it by mail at least 1 week in advance of Election Day to make sure you get that on-time postmark. Now, the other rule that the post office has been considering or proposed is quite concerning, and it has to do with the president's executive order around mail ballots and election mail in general. What this rule proposed was that states would have to provide an approved list of voters. USPS would somehow match that list of voters against citizenship, even though there is no reliable citizenship checking database. And they would withhold mail from folks who are not on the approved voter list and who they believed to not be citizens. That is obviously concerning. The United States Postal Service does not get to decide who gets the right to vote and who does not get the right to vote. That responsibility lays with election administrators. On the good news side of things, that has been enjoined for this coming November general election. So it will not be implemented for this coming November general election, but the courts will reconsider it again after this November general. So be aware that one will come back up again in the future as courts retake up the issue after this election. And then finally, the SAVE Act saga that never ends, the bill that keeps dying and keeps being resurrected in a number of different ways. The SAVE Act now has several different forms out there, and the most important thing is that they all require documentary in-person proof of citizenship, and they would all require some sort of photo ID when you return your ballot. So like a photocopy of a photo ID in your ballot envelope. It is a bad idea, and we will continue to speak out against it here in King County. It would disenfranchise thousands of voters to have to come in person with a passport or birth certificate to prove citizenship, and it's simply not the way that elections have been done for the entirety of the history of elections in our country. It has passed the House several times. The Senate continues to basically state it's not making it through the Senate, but it continues to try to be attached to a number of different pieces of legislation and budget considerations. So we do expect to continue to hear a lot about the SAVE Act. It continues to feel unlikely that that will pass, but again, that's who knows what our Congress and legislators will ultimately do. They are the deciders on that one. All right.
I beg your pardon. I'm so sorry to interrupt.
Oh, you're good.
We are the deciders. We, the people, tell Congress to reject the SAVE Act. And I just put the action link in the chat. Thank you, Haley.
Thank you, Allison. I appreciate that. Absolutely. Awesome. All right. Now that we've covered the headlines, let's talk a little bit about the actual mechanics of voting. So we mailed out ballots yesterday for the August primary election. Those should start arriving here in the coming days. If they do not arrive by Monday's mail, give us a call and we can help get folks their ballots. Yes, yay. Folks should be getting their ballot alert today as well if you are subscribed that your ballot has gone out in the mail. And so keep an eye out for it to get a replacement, or if it doesn't arrive, give us a call, send us an email at least 8 days ahead of the election. That is July 27th would be the deadline for that. Or folks can come and see us in person at vote centers and at accessible voting events. I'll talk about those a little bit more in a moment, but we're really excited about our accessible voting events. They are basically mobile vote centers where we partner with local libraries, food banks. We're at Compass Alliance Housing, or at the Somali Family Task Force, Ballard Food Bank, and a number of libraries around the area to bring that in-person service directly to folks. For you all, we will be at the Seattle Central Library in downtown Seattle August 1st on that Saturday. And I know lots of folks are downtown seeking services often, so come on down and see us. We can get them a new ballot. They can use an assistive voting device, or if they're not registered to vote, we can get them registered to vote. You can register to vote here in Washington all the way up through Election Day. It's just the last 8 days you have to do so in person with an election worker. You can also help folks access their ballot online and print them off a ballot as well. And that can be done through our online ballot marking program. The link is up on the screen for you as well. A little bit about vote centers and voting events. As I said, these are our in-person opportunities to come and get services and support, get a new ballot. We are open now and year-round at our office down in Renton at Elections HQ. Beautiful photo up on the screen. We will also have off-site vote centers as we get closer to Election Day. Those are typically open the Saturday before Election Day, Monday and Tuesday. And we're in Bellevue, Federal Way, Kenmore, Kent, of course, at our location in Renton, and then we are in Seattle as well. And then, as I mentioned, we are also doing 7 accessible voting events, our most yet, and we will do even more in the general election. This is a fairly new program for us over the last couple of years. And it's led by our amazing outreach team who go out, take all of the equipment, and basically set up a mini vote center in all kinds of places. I saw somebody on here from City of Shoreline. We'll be at the Shoreline Public Library as well. So we are trying to get to kind of all of the corners of the county. And we love to have folks come see us in person. And I would recommend, if folks need to come see us in person, not to wait until election day. If they can get in and see us at an accessible voting event or that Saturday before, even the Monday before, they are much less likely to encounter a line. The closer we get to 8 p.m. on election day, the more likely you are to wait in line. That said, if you're in line, stay in line. We will serve everybody who is in line by 8 o'clock. With everything happening around the United States Postal Service and postmarking concerns, ballot drop boxes continue to be the best and fastest way to return your ballot. We are now at 91 locations for the August primary, including a brand new box at the Central Library in downtown Seattle. We're very excited about that location, so woohoo! We've been hearing from folks that since we moved our box from the admin building, that he really wanted another kind of central downtown location, and we are so excited to be at the Seattle Central Library. It's just gorgeous. Go drop your ballot there if you're downtown. We're also newly at the Northgate Library, Bellevue, and Green River College campuses, the Kent Canely Safeway, and way out at the Skykomish Community Center. Skykomish is a community that gets unreliable postal service, so we are particularly excited as well to offer Skykomish a brand new drop box as well. Drop boxes close at 8 p.m. sharp, as do our vote centers. Again, if there is a line at the drop box, stay in line. There will be somebody to mark the end of the line, and anybody who's in line by 8 p.m., not within sight of the line, not walking to the line, actually physically in line, will be able to drop their ballot and have it counted as on time. One thing that often comes up, particularly around election rumors, there's this phrase I'm sure many folks have heard called ballot harvesting. What that means simply is returning a ballot for another person, and that practice is legal here in Washington State. It's not legal in all the states across the country, which I think is part of what drives the rumors and confusion around it. But here in Washington, you can absolutely drop somebody else's ballot off for them. We recommend doing so in a drop box. Make sure you're on time. We also recommend to our voters in general that you don't give your ballot to somebody that you don't trust. That seems obvious, but sometimes folks need a reminder. Your vote is really important, so only give your ballot to somebody you trust to get that ballot in. And of course, we encourage folks to track their ballot as well to make sure that it was in, received, and their vote is good to go. All right. One of the ways that we are encouraging folks to get out there and talk about elections this year is by making a vote plan. So there's a link up on the screen. You can access a PDF version of this. There's also one in every single local voters pamphlet. There is a make a vote plan template. You don't have to have somebody actually fill out this form. What it really is it's getting folks to think through those couple of kind of micro decisions and those couple of steps they need to take to get their ballot in. Do they have all their materials? Do they have a plan on what day? How are they going to return it? Do they know where their drop box is? Do they like to vote by themselves or with their friends and family? And thinking through those couple of basic questions helps folks take that kind of concept of voting and turn it into action. So even if it's just asking a couple of questions in conversation as you're talking about voting, that is fabulous. But we also put together a handy template in case folks want to actually do the filling out and putting it up and reminding themselves of their own plan along the way as well. I see a question in the chat, does Washington have ballot curing? And yes, we do. So if a voter forgets to sign their ballot, or if there is their signature doesn't match closely enough with what is on their voter registration record, we will reach out in a number of ways, including mail. If we have their phone number and email address, we'll reach out that way. If they're subscribed to our text alerts, they will hear about it actually the most quickly through that program and service. But folks have all the way until the day before certification to fill out a simple form, provide us with information, say, yes, I'm the one who voted my ballot, and we can go ahead and count that ballot. So they will hear from us, and they have, for this coming August primary, they have until August 17th at 4:30 p.m. to get back to us. And then in the general election, folks have nearly 3 weeks. So the primary election is 2 weeks, the general election is 3 weeks. And finally, we are here to help. And I want to emphasize that if and when you hear questions or rumors about elections, feel free to send folks to us or reach out to us. We are going to be your best source of accurate and reliable election information. And there's a lot floating around out there in the world. So if you see something and you aren't sure, just give us a call. We have real human beings answering the phone on our main line there. And we are always, always, always happy to make sure that folks have the information that they need to participate in our elections.
Haley, thank you so much for presenting all this amazing information. It is, it can be complicated, but we really appreciate you taking the time to break it down and kind of demystify some of it. To that, I really want to just promote. I had a number of things that I wanted to say, but I got to keep us moving with our agenda. That phone number you see on your screen works. There's real people behind that. They pick up the phone, they answer the littlest questions to the more complicated questions. Please consider calling 296-VOTE when you do have a question and you're supporting the communities that you work with and accessing civic engagement and being able to vote. Hallie, I see your hand is up. Go ahead.
Kevin, just a quick question in the chat from Martha. How can we find out about the locations of accessible voting events?
Yes, those are on our website, and I will drop a bunch of links in the chat for everybody here in just a moment as well. Yeah, we'll be able to find them there.
Great.
Awesome.
Thank you
Haley,
so
again,
much.
thank you so much. Go ahead, Hallie.
Thanks, Kevin. Haley and Hallie, thank you very much. We really want to acknowledge the excellent work of people at the King County Elections Office who have, over many years, been excellent partners, not only to all members of the voting public, but also with paying very specific attention to the needs of people experiencing homelessness, people who don't have good, reliable mail service, people who speak a primary language other than English. I think we have some exceptional public servants here. And one of the reasons that we wanted to make sure that Haley could come and share this information is just to underscore where we started. We are living in a time when our president and the federal government are actively seeking to suppress the vote and to strip voting rights from eligible voters in this country. Therefore, knowledge is power, and we not only want to ensure that everybody understands how our system works. I just signed up to get the text alerts. I'm so excited about that. It really gives people a sense of how the ballot moves through the process, but also to help spread good information. Remember, during the pandemic, there was so much fear, there was so much uncertainty, and people had legitimate reasons to be uncertain. Well, just as then, here we now have an attempt to spread false information, uncertainty, and doubt about the security of our electoral processes in our democracy. So we have to counter that by sharing good information and doing it proactively. So take some of the information that Haley shared, take some of the information that Danielle and Kevin have updated specific to homeless voters' rights. Share it in your workplaces, share it with your coworkers, share it with your clients, guests, residents, board members. Get the good information out there, because that is how we inoculate our democracy against the people who are trying to damage and undermine it. So thank you so much, Haley. I want to share with people, just as you started with some good news, the fact that the federal government has tried 13 times to sue states to get their confidential voting records, and 13 times federal judges have said no. So we are under attack, but there are effective ways to push back, and we are all part of it. The work of saving our democracy and improving on its flawed reality is up to each and every one of us. So I hope everyone who is eligible to vote gets their ballots. Take a selfie, dropping your ballot off, whether it's at a vote center, a ballot drop box, or in your post office box. And spread the positive, good, useful information to other people. I'm going to very briefly just acknowledge other things that are happening in our sector that I think everyone on this call is well aware of. Just a couple of weeks ago, Mayor Wilson and Executive Zahalai made the announcement that they were going to be pulling city and county funded contracts back to be administered respectively at the City Human Services Department and the County Department of Community and Human Services, leaving the King County Regional Homelessness Authority with the core responsibilities for administering federal Continuum of Care, or COC grants, applying for our COC grants for next year, and administering certain core functions, including the coordinated entry for all and homeless management information systems, as well as managing our COC board. Some of you may have just attended the COC convening that was earlier this week. We, the Coalition on Homelessness, like many of you, are members of our Continuum of Care, and the KCRHA is responsible for administering and managing that board. Talk about uncertainty, talk about questions, talk about people wondering what the future holds. I can't answer all those questions for you. What I can tell you is we have been in close communication with the mayor's office, the executive's office, Human Services Department, and DCHS staff about their plan to transition those contracts with minimal disruption to the people receiving services and the frontline staff and contracted agencies delivering those services. We will continue to bring them to our senior leaders meetings and at the right moments to our general membership meetings. And we're probably going to just need, as with many things, to keep our ears open, hear the questions that you all may have, and continue to press for true, meaningful engagement of providers and advocates in planning, not only for this administrative transition, but also for the future of our continuum of care. We are still anticipating that the federal government's hostility towards our COC will very possibly result in the loss of tens of millions of dollars of homeless housing funds, which is why, as we prep for our city and county budget processes, you will see and hear Hallie and me inviting you to advocate for housing stability contingency funds. And we are all committed to ensuring that our community gets our fair share of federal dollars. This is an ongoing story. I think many people are aware this is a highly changeable situation. There continue to be multiple lawsuits at the federal level about the actions HUD has taken. And we are sharing with you in the chat a little bit of information, both the Seattle Times report about, actually, Hallie, you shared the statement from council members Rink and Foster and Fain and Baron, but there's also a link to the Seattle Times story just for folks who might have missed it. So please feel free to put any questions you have in the chat and reach out to us. Our goal is to ensure that no person loses their housing, access to shelter or other services in our community as a result of federal cuts and actions. And we will continue to do what we collectively have done effectively since the beginning of the Trump regime, which is to monitor closely, speak up loudly and effectively, and insist that our community makes sure that people are safe. All right. I think that's my best attempt to be brief, and Hallie may have a quick action alert that she's going to share with you about the federal COC, in addition to some really important local actions that we're supporting as well.
Thanks, Allison. And as you were talking about the risk to COC dollars, there was like rolling thunder like outside where I am in North Seattle. So that was just like the universe is in agreement with you, I think. And for folks, I wanted to just highlight some actions that we've been taking in the city of Seattle to protect renters. So we're working with the Stay Housed, Stay Healthy Coalition on a bill that's currently in committee in Seattle City Council that would ban junk fees for tenants. And when I say junk fees, that's things like pet rent, various like administrative fees, charging someone money to pay their rent online, stuff like that. There's all sorts of things that we're seeing landlords do in the city of Seattle. Oh, there's lightning. Cool. That is exploitative to tenants and increases the already expensive cost of housing here in the city. So if you are a Seattle resident or if you work or play in Seattle, go ahead and take this action to send a letter to your city council members. If I could have Danielle drop that in the chat for me. This will send a letter to all your council members urging them to vote yes on this bill that would ban pet rent. It gets a vote in the Seattle Housing Committee this coming Wednesday, the 22nd. And there's also a really fun event to support this bill coming up on Saturday from 4 to 6 p.m. At I think it's at Cal Anderson Park. Sorry, I should have written that down.
I think it's at Volunteer Park.
Oh, Volunteer Park? Okay, I couldn't.
Yeah.
I was like, it's a park on Capitol Hill. Anyway, 4 to 6 p.m. There's a rally, Pets Against Pet Rent. So bring your furry friends and show up for protecting tenants. And we'll drop a link to Cal Anderson. Okay, thank you, Cal Anderson. Let the record show. Cal Anderson. And we'll drop the link to RSVP for that in the chat as well. Thanks, y'all. That's all for me, and I'll pass it to Kevin.
Thank you so much, Hallie, and hopefully folks can see me and hear me. And thank you, of course, Allison, as well. We are back on schedule and so happy to have some time for member announcements today. Speaking of thunder, I don't know if that's coming through the mic. I just have to do a better job of not being startled and stay on camera. But we have a few announcements already planned. I got another email, and so hopefully we'll be able to get to that. But for folks who are still here, if you have a community announcement, if you have information that you'd like to share, just go ahead and raise your hand, and we'll come around and call on you shortly after we chat through some of these. So for the first one of the announcements that we have planned, we did announce it last month, and it is coming up just in a few days here, but the Queer Housing Forum and Resource Hub is on Saturday, July 18th, 11 a.m. to 2 p.m. It's hosted by Queer Power Alliance in partnership with Q Law Foundation and Be Seattle. This is taking place at the First Baptist Church in Capitol Hill. Oh, and the link is already in the chat. Awesome. Thank you. So yes, that event is happening on Saturday from 11 to 2. The next announcement we have, DCHS and Connections Health Solutions are hosting a open house, community open house at the Future Crisis Care Center in Seattle on July 21st. So they're welcoming the community into the building that will soon provide a place where folks can all go to get urgent care for a wide range of mental health or substance use challenges as well. At the event, they're going to provide updates and overviews of the Crisis Care Center services. There will also be a community resource fair with other information about 24-hour crisis services available in King County. I have a link here, and I believe we have a flyer to share as well. Oh, we're already on it. So there should be a link in the chat already. I'll just go ahead and add time. And that is it for the announcements that we had scheduled. Angie from Goodwill has sent me some flyers and some information. Angie, if you're on and you have a minute and you want to hop off mute, you're welcome to take a minute and share what's going on at Evergreen Goodwill.
Yes, so thank you for letting me have this time. We are beginning registration. You can sign up with the QR code, and as you see, we have many centers. We have one in Renton, Kitsap, Shoreline. So yeah, it's free classes, and we believe in digital equity. So if students don't have a laptop or a hotspot, we provide that. Yeah, so knowledge is power and jobs save lives. So hopefully if you guys can distribute, that would be great. Thank you for the time. Thanks so much.
Of course, Angie. I will go ahead and work on getting some of those flyers into the chat right now.
I
But
put the King one in there. I could put the rest, maybe.
Sure. I just want to take a moment and turn off the recording. We usually do that right before the start of community announcements, but we're going to go ahead and end the recording now. And then we do have some more time left. So